Friends, I am very glad to introduce you Dr. SAMAGRA AGARWAL sitting right in front of me, who have secured rank 6 in November 2015 AIIMS exams. Dr. SAMAGRA joined us in his foundation when he was in pre-final year and continued the same in till his internship with us. So first of all, Dr. SAMAGRA, I must congratulate you for securing rank 6. What is going through your mind right now?
I mean, it's really hard to put it in words. It's not something you get to experience in every day, and it's not something that you can so simply just say that. But it's a wonderful feeling. I mean, it goes without saying that. And I'm just quite happy that my result went good. Yeah.
That's pretty great. You must be receiving calls and best wishes from past evening, I think, regularly.
Yeah.
So that must be a very nice feeling. What are your experiences? Because you have joined us from the very start, very beginning, foundation till now. What are your experiences with DBMI? I'm sorry.
So when I came here in my pre-final years, I had no idea what to expect from a coaching for PG entrance, because obviously I had no clue that how it operates and how it is supposed to work. But the teachers here were quite helpful in all aspects, and they covered all the subjects elaborately and yet concisely enough so that you end up having a set of notes which you can read in your last month or your last day, and you can read it again and again just to ensure that you have a good grip on the subject, and that actually helped me a lot. So it has overall been a very good experience with Dr. Bhatia Institute.
That's pretty great. Thank you for that. I've heard that most of the questions, I think more than 20% or near to that, came from medicine. So how does that help you to crack, or something you want to share with us?
Yeah, so a majority of questions came from medicine or related subjects, and it is quite similar to, I think, USMLE pattern in that way. And the best part was that most of the questions had already been covered in Medicine Essence book by Dr. Bhatia, and the questions were somehow related to something that you must have read in the past 5 years of your curriculum. So there was nothing new in the paper. It was all quite, I must say, solvable. So that was the very different thing about this exam.
That's pretty great. Any specifications or any some suggestions for other subjects? Any particular subject you have liked the most or something like?
So as I said, that for medicine, the Medicine Essence was quite sufficient in as far as the questions go, and for other subjects the notes were very helpful, especially the minor subjects related to surgical disciplines. So ENT, ophtha, anesthesia, the notes in these subjects were quite helpful, and they helped me to I must say, just understand the subject better, and to on the final day help me to write to get the final answer easily.
Okay, that's not a problem. Any specific words or something for our test series? You have joined our test series too, so something for that?
Yeah, so when I joined test series first in January of this year, the first subject was pharmacology, and the level to which the pharmacology preparation went over here, it almost set a standard that people can actually go up to this level and read pharmacology and any subject to that extent. So that actually set up a very high standard and motivated me to read a lot more, and so I was personally very impressed by the pharmacology TND. But otherwise all subjects were covered, and most of the topics that were covered were ultimately in the examination question book. So it was quite helpful in that way.
That's pretty great. We had a class of visual basics at a time. So was that helpful to clear some of your points, some of your basic logics or something like that? Because a lot more questions are getting into especially getting for visual basics. So anything for that?
Yeah, so as you must be knowing that about 50 questions in this AIIMS exam were actually image based, and the only thing you needed to know was that how does a image of such a parasite or something looks, And so visual based program was very helpful in that manner, because if you have seen the image once, you can have a go at that question and have some chance of securing a better rank. And so I was highly impressed by the visual based program in that way.
That's pretty nice. My last question, some special things you have noticed in our smart book app or something like that?
Yes, so I used to regularly use the Great Stack app, and the best thing about that app is that you can always, read questions on the go, and you do not really need to sit down at one place and turn the pages of a book again and again. So it helps you get a grasp of a subject on the go, and you can just read it anytime, and the questions are nearly comprehensive, and they are mostly covering all the subjects. So I would highly recommend that as well.
Any final words for the upcoming students, for your colleagues, for your juniors? You want to share your experience or something, some suggestions or anything like? Please go ahead.
Yes, so if you actually want to get a good rank or have some hope of getting a good rank, the best thing you can do is revision. And for revision, the most important thing is that you need to get a concise set of notes which you can read regularly again and again, and get a grasp on that thing, because the topics are never new. The topics are repeated again and again, especially in the AIIMS exam. So I would recommend that just get some set of notes and try reading them, and hopefully you will do quite well in the exam.
You've heard from the man. It's again Dr. Samagra Agrawal. We are congratulating you on DBMCI behalf, and wish you the very best of luck for your future. Obviously you have secured 6th rank, so thank you all for seeing us on Facebook or YouTube or wherever you might have seen this video. Thanks a lot.